morning, everybody. Today I'm excited. I've got Dr. Eram. She is the new joiner here at Dubai Herbal Treatment Center. She's our general practitioner, and we're going to have a good conversation and find out a lot about what's happening with her. Please remember that if you do have any questions, feel free to ask them at any point. So, Dr. Eram.
Hello.
Tell us about yourself.
Hi everyone, this is Dr. Eram Mohammed, and I'm here at the Dubai Herbal and Treatment Center along with Dr. Travis. Just a quick introduction about myself. So I've been in Dubai for all my life, and
So are you local or you're not local?
Well, I'm Indian, but I've been here for all my life.
Do you speak Arabic?
A little bit.
That is disappointing, hey? That's disappointing.
Yeah, not so much, a little bit.
And tell us, what is your specialty?
So I'm a general practitioner.
Okay.
And I've been a general practitioner for the last 4 years.
What does it mean to be a general practitioner?
So basically, I'm the first healthcare professional that I think essentially everybody would need. I know that in Dubai, the healthcare system is a bit different as compared to other parts of the world, but I think any medical concerns that people have, GPs are usually the first ones to have a look at them and to then guide them.
I remember as a kid, we had our family practitioner.
Right.
And you went to him everything from your nose to your toes.
Right.
And a family practitioner, there was that personal connection. It seems that that's fallen away. When I meet with you, I get that personal connection. Presumably that's what you're wanting to create.
Well, yes. Ideally, that's what I'm trying to bring in. I want people, or at least my patients or clients who come to Dubai Herbal, to just have one doctor who they can run to each time that they have any basic issue or even a complicated one, and they want some kind of direction in which they get an idea of what is the next best step to take, right? And that works for them.
In terms of dealing with patients, is people need to have someone that they can confide in, they can sit with, they can have that detailed conversation.
Right.
Tell us how you've come into this space. What is your history to get you to this point?
Well, I've graduated quite recently, and I do have that oath that we take during our ceremonies, and we always are meant to believe that our patient has to be dealt with utmost care and priority, and I feel that I still hold that within me. So my patients or my clients have a bond with me that I really feel it's important with any practitioner, with any physician. I feel it's very, very important because until and unless you build that bond with someone, they would want to trust you with their personal history or even a psychological aspect of their life that can obviously contribute to a lot of things, such as stress, anything that's affecting their mental well-being.
Because what I see now is health is not a one-dimensional conversation. Very infrequently are we just dealing with health from one aspect. Health is a lot more detailed than that.
Right.
So how do you approach a patient when you meet with them? What is that starting point for you?
So basically, any patient that comes in definitely requires a very detailed history of what brought them in to the place to begin with, and then I then start digging out certain aspects of their life that possibly would contribute to the condition or the symptom that they're talking about. That follows with, of course, physical examination, which is important just to give that comfort or give that trust to the patient that me as a physician has looked at every aspect of what they're complaining about. And then that is followed by, of course, detailed testing, which we do to just understand where are the imbalances, which system the imbalances are found in, and then based on that, you then follow up with the patient, depending on how complicated or how easy the interaction would become when explaining the results to the patient. So that is something that I feel also is very, very important. The follow up after you do any blood work or after you do a consultation.
Sure.
I think many people feel that physicians are not really doing this anymore. I'm not sure what is the reason.
Well, I mean, certainly if you're listening now, you're feeling Dr. Eram's heart, and that's the reason why we have you here, is you bring a massive heart to DHTC. As we said earlier, please feel free to ask questions at any point. For me, I would like to go back a little bit more, and why, what in your past, what in your childhood, what made you say, this is the kind of doctor that I want to be? I mean, there's choice number one, to be a doctor, but choice number two is the type of doctor. So why did you choose to be this type of doctor? What were your influences?
Well, I definitely did get into medicine because I felt that I needed to give back to the community, and because I'm Indian, I think that's the best option that you're given.
Is that like an Indian quality, to give back?
Yes.
Like Mother Teresa, Mahatma Gandhi kind of far.
Yes, to give back, and of course, being Indian means you're gonna either become a doctor or an engineer, right? So you always want to have those highly respected professions in your family. I guess that was, that's what my parents thought, at least. For me, it's just about how many lives can you touch, right? That's the main idea. I did start my education with conventional medicine, but at some point I realized that it's not just about giving medications and then that's the end of it, right? I do feel that there's a lot more to health than just prescribing medications and dealing with it in a very practical manner. I do feel that people need to be addressed, people need to be understood. I think that's what really matters to a person. And I would like that if someone did that to me. If I went to a doctor and they just listened to me, healed me through the way that they speak, healed me and understood me from the core of what I was complaining about, I think I would really love that.
And I mean, you've recently joined DHTC.
Yes.
What attracted you to DHTC? I mean, obviously we have a very specific philosophy, a very specific intention, a very specific mechanism, hand in hand for your well-being. What attracted you to DHTC, and how do you feel that you fit in?
Well, to be honest, it's all in the name, right? The Bioherbal and Treatment Center, which definitely means that this place is more focused on being natural, going about with treatments and therapies that don't necessarily just lie with chemicalized medications or interferes with other aspects of your organ systems, which it shouldn't, right? It's very focused, it's very detailed, very customized. So that's something that's amazing about this place. Obviously the people who come here believe in natural therapies, and that's what directs them here. So half the job is done there because you have patients who already believe in natural therapies. You don't necessarily have to have that struggle with a person to convince them that natural therapies are better. So that's something that's really nice as well.
So how do you fit in? I mean, where do you start your treatment of people? As a general practitioner, as you said, the convention is that it is medicine chemically oriented.
Yeah.
How do you start your treatment protocols?
Well, there's a lot of departments over here that have beliefs with Ayurveda, homeopathy, Chinese medicine, chiropractic medicine, and I do believe that there is some medical aspect to every complaint that a person presents, whether it's psychological, whether it's physical, and me as a general practitioner, I have some tools that I use that help a person with whatever they're complaining about. So you have, IV infusions, you have hormonal therapies, and this is what I basically work with.
Yeah, I mean, this seems like a very niche component to dealing with someone's health.
Yes.
Explain to us IV infusions. First and foremost, from my own personal conversation, please get rid of some of my fears of IV infusion, because I'm sure that there are some patients there that have fears, and as we said earlier, if you do have questions, please ask. So yeah, deal with IV infusions, explain it, what is it about, how does it work, go through that with us.
Right, so I know that everybody obviously tries to work on a better diet and a better lifestyle. But sometimes, because of the unavailability of the quality of food that we're looking for, or because our gut just doesn't seem to absorb the kind of nutrients that we need, we tend to start declining in certain minerals, certain vitamins, certain proteins in our body. And that's where really you start figuring out, okay, I'm feeling this, I'm feeling tired, I'm feeling, like I'm losing my hair. So it's very specific, to be honest with you, in terms of how your body starts telling you that it's lacking certain nutrients, but we tend to overlook them and continue living our life.
I think what you just mentioned there is important. A lot of people are dealing with symptoms on a day-to-day basis that they've got used to having.
Yes, because we tend to think that it's probably a part of aging, but it's actually not. It's the loss of our minerals, the loss of our hormones that eventually start showing up, and it should never be okay. Lack of energy, hair fall, being tired throughout the day, having memory gaps, I don't think it should be okay for you.
Just listen to that. None of that is normal. None of that is normal. Your normal is to exude energy and confidence and excitement and be full of life.
Yeah.
Tell us about the bioidentical hormones, is that correct?
Yes,
Tell us about
bioidentical hormones. So hormone therapies have actually been in place for a very long time as we know it, and back then the idea was to go ahead with replacement therapies in people who were either deficient or people who had menopause or hormone deficiencies because of the lifestyle or because they were genetically predisposed to those kind of conditions. But we now have the bioidentical hormones, which are a more natural way of replacing the hormones, and because it's natural, it has lesser side effects. The application is much easier, so those are some advantages. But every individual has some hormonal deficiency. It's not a very known thing. Every person has a hormonal deficiency.
And temporary, or would you say that's a permanent conversation?
It would be a temporary conversation, but it depends on what's causing that hormone deficiency, right? If it's something that is because of the food or the lifestyle you're living, or is it because there's some underlying deep condition that you're dealing with? So it really depends on person to person, but I feel that, or at least what I've noticed is, every person should be aware that hormones are a huge aspect of our health.
So if one of the people listening in is dealing with challenges of some sort and you haven't had your hormones checked,
yes,
maybe this is a good time to start.
Yes, I think it's a must for every person to know where they're standing in terms of hormones.
And certainly as we age, hormones change, we know that.
Yes.
And do you monitor through that with your patients from as they go through the different milestones of age?
Well, yes. One of the biggest challenges actually is to have follow-ups with hormone therapies or just keeping in check your hormones, because the idea of hormones is not very well infiltrated amongst our population, and I feel that it's not just a one-time thing. You're gonna have to have regular checkups with your doctor and to understand if they're balanced or are they starting to decline, because as you mentioned, with age it tends to decline and you're going to have to keep up with that.
Well, I think this brings us back to having a general family practitioner.
Yes.
Someone who you've built a rapport with and a relationship with, that you can go back and see as you go through different stages of your life. Certainly when we talk about hormonal, one has to bring females into this conversation.
Yes.
Not because females are anything special, just kidding. But certainly hormonal issues in females is an important conversation. Is this something that you tackle and deal with?
Well, yes, because every woman eventually happens to, go through menopause. And I think that's one of the biggest challenges that we face.
Is menopause normal?
Yes, menopause is normal.
Good.
And there's nothing wrong with menopause, and I think it's a good thing. But
because certainly you hear, and certainly if I speak to my mom and my aunts and so on forth, I've had menopause, as if it's like a bad thing. Explain menopause a little bit. What is it?
So menopause is basically when your hormones start declining. Estrogen, progesterone start declining, and eventually there comes a time when your ovaries are not being stimulated enough, and your menstrual cycle just starts gradually halting.
But I mean, certainly people, when they talk about menopause, they talk about it in a negative sense, that they have a whole bunch of really negative symptomatology that comes with it. Can someone go through menopause in a positive manner?
Actually, yes. The answer to that is yes. I have.
Well, this is good news. This is good news. Is there anyone on this listening who is going through menopause now and is having challenges? Please ask some questions, because you can do it the right way.
Yes, I've actually had a couple of my patients who went through menopause, but in a very smooth way.
Right.
No hot flushes, no sleep disturbances. It was very, very smooth for them.
But what did they do differently? Why?
To be honest with you, there's nothing that they do differently. It's just that the kind of lifestyle, again, everything comes back to lifestyle. So it's just the lifestyle that they probably were living since they were children. The right kind of food, having good physical activity, maintaining your hormones through not just taking hormones, but then having the right kind of food, the quality of physical activity that you give to yourself, I think is very important, because then it eventually elevates your hormones naturally.
So do you counsel your patients on lifestyle mechanisms?
Yes, actually, because that is 50% of the patient's job that has to be taken care of. Of course, 50% of the medical work has to be done by me, but the rest 50% has to be done by the patient,
And again, coming back to what you said earlier about Dubai Herbal and Treatment Center, there's a certain caliber of patients that come here, and those patients are the ones that recognize that there is another way of doing things, the more natural way, the more herbal way, but also that they have a responsibility to their own health.
Yes.
Not just come to the doctor, here's my problem, take care of my problem, when it's done, give it back to me.
Yes.
It's that there is that connection between doctor and patient, and the patient has to do some work. Talk a little bit more about that.
One of the things that I've always seen is most patients, not all, most patients like to walk in, this is my problem, this is my blood work, fix it. Yes, I do understand that we as physicians have the knowledge to fix it and will fix it, but at the end of the day, what you do after you go back to your own home is on your shoulders. So I think with medications, with IV infusions, it's your contribution as well. You possibly will not get results if you take IV infusions, let's say for energy, for detox, for hair, for skin, and then go back to a lifestyle that is adding more toxins to your body. So
yeah, certainly when we talk about hand in hand for your well-being, when I listen to the word well-being, well-being for me is not just I'm well today.
Yeah.
Well-being is a sustainable place. And I feel that we need to be promoting that to people, that for the rest of your life,
yes,
you need to be thinking of where you're going to get to in your 50s and 60s and 70s. Let's change the direction somewhat. What are some of your favorite cases, and how do you tackle those cases?
Well, out of the short-lived career that I've had, there are some cases that I've just kept in my memory because of the amount of patient satisfaction that came along with it. So I had diabetic patients who were on all sorts of medications but couldn't come to the identified HbA1c that they were told to get to, and they tried all therapies, all sorts of medications, even with their food they were pretty good, but they just couldn't get there. And I remember seeing those patients, and within a couple of months of therapy with the IV infusions, we hit the target, and I was really blessed that my patients were satisfied with what they were given, and the amount of thank yous that I had in return was amazing. And I think those moments are the one where you really...
At the end of the day, why we do this is for that change that patients get to see.
Exactly.
I'm going to ask again, if there are any questions, please feel free to ask, particularly if you are dealing with something that is chronic and you've been for different therapies of different sorts and you haven't really found the solution. Maybe you want to ask Dr. Eram her thoughts and her opinions and stuff. In terms of your direction going forward, where do you foresee that you're going to be taking this department at DHTC?
Well, as of now, I'm just adjusting. But in the next, I believe 5 to 10 years, you just want more people to be aware of the fact that there are natural therapies available. You want more people in the UAE to convert to natural therapies, and of course work hand in hand with other departments as well, just to make sure that every problem is looked at from different aspects of medicine. And I hope that more people start identifying and, most importantly, admitting to the issues that they have. And the Bioherbal and Treatment Center possibly becomes one of the leading centers for natural therapies, and I really hope that I have a part to play in that.
Yeah, I certainly foresee that the Bioherbal Treatment Center being the stalwart of health and well-being, and people look to us for the great understanding of how to simply return their health, not only for them but for their family.
Yeah.
Do you have a few simple tips that you wish to give the people that are listening in terms of what they can do today to start a process of being healthier?
Book an appointment.
Hey, that's easy.
But in just terms of start today, I really feel that a good health is not something that you can achieve in one day. It's really about progress. As long as you're on the track, I'm sure that you will hit the right point someday. But taking care of yourself shouldn't just happen because today you're in a good mood or today you feel ill. I think it should happen every day. And the more people identify their problems or recognize their problems, the more they want to talk to someone about it. And I think you shouldn't run away from that.
You've mentioned a few times now about having a point that you're going after.
Yeah.
A goal setting in healthcare. How does that work?
When I say you need to set a goal for yourself, you know, it comes with practice, right? Each person has a different goal for themselves, and at the end, what matters is what you were, let's say 10 years ago, and what you are right now. And being so invested in anti-aging medicine, I do believe that each person should function, or at least their cells should function, at least 5 years behind their age. So when I say that, it just means your metabolism should be 5 years below your age. That's when you know that you're functioning at the optimum range.
And is there a way of knowing this? Is there a way of testing this?
Well,
Can
yes.
one of our audience members come to us and then say, I want to know my functional age rather than my chronological age? Is there a way of testing that?
Well, yes, there are ways of testing that. Cellular metabolism can be tested.
Wow.
There's multiple tests that need to be put together to get a clear picture of where you're standing. Along with that, just to make a short point over here, you can actually see the longevity of your cells as well. So that's something that I think is very important. And fortunately, nowadays we have a lot of medications through IV infusions, which also increase the anti-aging effect in your cells. So I think that's something that everybody should be interested in.
Well, maybe what we should do is have like a competition of some sort where we can see, on TV they have those greatest losers where people come and
Right.
lose weight. Maybe we should have an anti-aging greatest
Sure.
loser competition where the person starts and they're 104 in terms of functional age, and then they come down to maybe 40 in terms of functional. It'll be a good competition.
Yes.
Fantastic.
I think it should
Well,
be.
I would like to say thank you very much to Dr. Eram. I know
Thank
that
you
we
so
do have a question that's come through, so let's take it.
Do you have any hormonal therapy for menopause? And if there is one, how long should it continue?
Good question. So menopause is something that will be there throughout your life, and hormonal therapies usually for menopause specifically have to be taken throughout your life. It helps you elevate your hormones. It helps you be at your optimum best, have the best quality of life that you have, as we know that menopause brings in a lot of decline in body functions as well, such as sleep disturbances, hot flushes, night sweats. You have a lot of night sweats with menopause. One of the things that men generally complain is women become irritable in their early 50s, and I think that's one of the symptoms as well of menopause. Is it's just a hormonal thing.
But certainly as a person goes through menopause, the dosage would need to change.
Yes. You always have to find the sweet spot for yourself, and it's not the same for everybody. It depends on the degree of decline in your hormones. So it's something, again, very customized, very personalized. So.
And perhaps a question that has just jumped to mind for me, and an audience member might have that, we have this HRT, hormone replacement therapy. Can the bioidenticals be taken in conjunction to that? Is it something that they'll do either or? How do you deal with that?
So HRT is something different from bioidentical hormones. But when I say bioidenticals, the idea behind it is that the structure or the molecular structure of the hormone that's being compounded is very similar to the one that's in your body as compared to the synthetic versions. That's why you have a lot of side effects associated with the synthetic one. Bioidenticals normally can be done in low doses with the same effect as compared to the synthetic hormone replacement
Wow,
therapies.
that's amazing.
So you should not be taking both of them at the same time. It's an either and or situation. But definitely considering the amount of people that get scared from the side effects of hormone therapies, I think they should definitely give the bioidentical.
But certainly people would come to see you on HRT.
Yes.
So you would then help them to get off.
Well, yes, I did have a lot of patients suffering from thyroid disorders who were initially started on with synthetic hormone replacement therapies, and we did convert them to bioidenticals, and the results are obviously very, very satisfactory as compared to the synthetic version. So I think that's something that
are there any side effects for hormonal therapies?
Well, yes, hormone therapies usually do have side effects, but just like I mentioned, bioidentical hormone therapies generally do not have the same degree of side effects as hormone therapies. And just a small note that I would like to add over here is everything in life has a side effect. It's just the way that you dose it, the way you deal with it, reduces the side effects. So that's something that's very important to understand.
Everything has a side effect.
Everything.
Whether it's a positive or a negative,
yes.
Everything has a side effect. There seems to be quite a few questions now, so we're going to take them as we go. Yes.
Do you treat infertility as well?
That is a good question. I have treated a couple of patients who suffered from primary infertility, and I would just like to mention a small incident about a case that I had. One of my patients previously was about to have IVF treatments because she suffered from primary infertility, and I told her to give me 3 months of her trust and of her life, and I said that if we don't get to the target, then we wouldn't I wouldn't force you. And I remember starting her with IV infusions, a customized version of the IV infusion specifically for infertility, and she took 3 sessions. In the 4th session, I called her to ask her what day she wants to come in for her appointment, and she said that I'm not coming in because I'm pregnant.
Wow.
So that was the most touching situation for me,
yeah.
And I felt really happy that I could save her from doing IVF and all that weight gain and the repercussions of IVF.
I mean, certainly something that I feel is when you do herbal and natural therapies, it might not work.
Yes.
Let's be realistic about it.
Yes.
But you don't lose in that process.
Yes.
And certainly it's worthwhile as a primary mechanism to go down that route. And as you said, to give some time. You can't take one pull and expect the miracle to happen.
Yes.
It does take time for physiology to change.
Yes.
Are there any further questions?
What sort of infusions you recommend for skin brightening and for hair? Like we've heard the word.
The main idea for skin brightening is not using any chemical component that helps you whiten your skin. I've always been very specific with this note. I think I would love the audience to just understand the difference between skin whitening and a glowing skin. We have a lot of infusions that contain glutathione, which is an antioxidant that helps you purify your blood. And once you heal yourself from within, once you flush your liver, flush all the toxins out of your body, you then tend to see differences in your skin because a healthier you inside is, reflected out on the skin. So that's the idea. We use a lot of infusions with glutathione, with high dose vitamin C that helps you lighten your skin, have that glow in the skin, because at the end of the day, the idea is just to purify your blood and purify the toxins that are there in the body. So.
And certainly the person is going to have a glow inside as well, that they feel amazing.
Yes.
Thank you very much.
There's one more question. A client says that he's a diabetic and always feels fatigue. Should he opt for infusions like those energy boosting infusions, or should he be relying on his medication?
Well, the main idea of why his fatigue is there in the first place is very important. His his levels of blood glucose levels need to actually be analyzed, and if there is something that we can do to control that, it will eventually relieve the fatigue. And yes, we would do that through IV infusions as well, so it really needs to be assessed, but he's more than welcome to join us at Dubai Herbal.
I think that's an important question. The person wants to feel something,
Yes.
but they don't really know why they're not feeling that, and that needs to be
Assessed.
discovered.
Yes, yes.
And I always like to approach that from an honest place, which is what I'm hearing from you, is once I know what is happening, I can give you the answer.
Yes.
So certainly, thank you very much for those questions. Thank you everyone for joining us. Dr. Eram, it was an absolute pleasure chatting
Thank
with
you
you.
so much.
And we will be continuing this in 2 weeks from now. Have a glorious day, and remember, Dubai Herbal Treatment Center is here for your well-being. Have a wonderful day, and we'll chat soon.